depression begin prenatally, meaning as soon as you find out you're pregnant, you can begin to display symptoms. Yes, there is a higher likelihood of experiencing postpartum depression if you've struggled with depressive symptoms before getting pregnant.
Can you say that one more time?
Yes, there is an increased likelihood of experiencing postpartum depression if you've struggled with depressive symptoms before getting pregnant. And so, of course, typically someone can carry that into pregnancy, and it does affect the fetus. I'll get into that later. But yes, it's also known as the fourth trimester.
Awesome. So, Ms. Dana, anything you want to add to that?
Well, what I wanted to add is that it also happens in men. I don't know if many people know
I need
that.
you to say that really loud because that was powerful.
Men also experience this phenomenon. It is called paternal postnatal depression for them.
So right there, if you just heard what she said, let me see you put that on the screen because she just said something so extremely powerful. Right? I'm going to have her say that one more time. And I'm going to have you just say that a little loud because I want to make sure everybody hear that. That is powerful.
Yes. And a lot of people don't know that men also suffer from this depression phenomenon after the child is born.
Wow.
It's called paternal postnatal depression, but it's very similar. It manifests a little bit differently in men than it does in women. You talked about the manifestation in women. For men, the top symptom and sign is anger.
Wow.
Anger, violence, angry outburst, irritability, also an increase in risk-taking behavior.
Wow. That's good.
You'll see substance abuse, impulsiveness. You'll see challenges in functioning, anxiety, irritability.
Wow.
Yes. So men don't do the crying and the outward expression of emotion.
Yes, ma'am.
So that's how, but it's still the depression.
Yes.
And they're more likely to get it if the woman is suffering from it. Isn't that interesting?
Wow.
Yeah. So if she's suffering from postpartum depression, there's a higher likelihood that he will suffer as well.
Wow.
Yes.
Wow. Go for it.
I was going to say one more key element. It doesn't have to be the biological father.
Right. That's right.
It's the father in the household.
Yes.
So, that's a big, thank you for mentioning that.
Did you guys get that? Wasn't that powerful? I see Monica saying, oh, wow, Monica is my spiritual daughter way in Michigan. God bless you. Love you tremendously. Love her. Definitely tremendously. I think that was really powerful. And I love the fact how you guys brought the men in.
Yes.
And how we can't forget the fathers.
That's right.
That is so powerful. So let us know definitely if you have that. And if you guys got that, and if you guys want to hear a little bit more on that in reference to that. So anyone here have anything they want to share? Because I think that was powerful.
Yeah, that's good.
Good for it. So let me ask a question, right? And one can do for the women and one can do for the men. If I sense that my significant other who's a male experiencing that, what can I do to help him?
You want to do the male? Go ahead.
Ask for help. It's that simple. Just ask for help. If you begin to recognize symptoms, and it doesn't have to be, oh my goodness, like Dana mentioned, crying episodes, because it looks different in men. So for men and for women, if you recognize it in each other, simply ask for help. We have the number on the screen right now, because if you continue to dwell in it and untreat it, and you reach beyond the 6-week mark, this turns into postpartum psychosis for both genders.
It gets worse.
Go back to that again.
Yes.
Go back. Y'all got to let us. You know you do crazy. Y'all got to let us savor that. So you said something about 6 weeks.
If it goes beyond 6 weeks, it then shifts into the medical term of postpartum psychosis.
Tell them what that is.
Postpartum psychosis is a mental disorder.
Wow.
And so, yes, a man or a father that is raising a newborn baby can develop a mental illness based upon the postpartum.
A serious mental illness.
Very serious. You lose touch with reality.
Yes.
If I could just get analysis or comparison.
This is to help the people.
This is something people aren't generally familiar with, psychosis, but people are more familiar with, maybe they've heard of schizophrenia or bipolar. When someone goes into psychosis, they lose complete touch with reality. They may have delusions, hear voices. They really, really suffer, and they don't know what's happening around them.
Wow.
Difficult to reach them.
Yeah.
So then you go into a situation where they're in big trouble. You're going to need professional help,
Yes, ma'am.
medication,
Yes,
support systems are very important.
I love it.
So good.
I love it. I love it. Oh no, I wasn't stopping you guys.
no.
And also, too, that can turn into suicide ideation.
Yes.
Wow.
And where that comes from is when you start not thinking that you are a good parent, you're
Mhm.
thinking that your child will
Absolutely.
be better without you.
Wow.
Yeah,
And this
yes.
is all stemming from postpartum
Mhm.
depression. So you begin to think that. So yes, that's a point where you really need to be open about reaching out and getting help. And a lot of times women or men may also be ashamed
That's
of
good.
feeling that
That's
way.
good.
You know,
Shame
when
is
they're
huge.
ashamed,
Yes.
they're thinking that, oh, I'm in a bad place because I'm not recognizing the fact that I've got a new baby. Most people with a new baby are excited and happy, and they feel like if they're not excited and not happy at that moment, that they're feeling
Something's wrong.
ashamed that
Mhm.
something's wrong.
Mhm.
And it's nothing to be ashamed about
I
because
love it.
a lot of people really go through that.
Yes,
They really
yes.
deal
it's very
with it.
common.
And yes, it's very common, and they think that something's wrong with them when it can stem from
Chemical
your
imbalance.
chemical imbalance with your
Right.
hormones being dropped. Your hormones are be low during the time that you're pregnant, so your hormones are out of balance. So that's where you have all those crying spells and
Mhm.
very emotional. So yeah,
Are you
so-
good? I do want to ask a question.
Mhm.
There is a question coming in, and she says, are women that battle with PPD more likely to battle depression in their later years?
Yes.
Who wants to take that question?
That
Yes.
is a yes. That is an absolute yes, but it does not mean that you are tied to that diagnosis. And so the earlier you seek treatment,
Yes.
the better outcomes that are there. And that's science, that's research, there's statistics
Yes.
behind it. You just want to seek treatment right away. Postpartum, also, let's look at that term just for a moment. It simply means how Miss Brenda Ward said, it means after giving birth.
Mhm.
Your child can be 18. You
Come
have
on with
given
that.
birth.
Yes.
And so if you're struggling with depression, go seek help. It's
Yes.
okay to just seek help from somebody. You may not find solace in your immediate circle
Mhm.
or your spouse or whatever. That's why there are therapists and counselors here to give you that
Yes.
unbiased support that
Wow.
you need.
Yeah.
So just keep in mind, postpartum simply means after you've given children. This can also affect people that are grandparents.
Yes.
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 Ooh.
And it's interesting, couple of things. I wanted to note what you said about shame,
Mhm.
also guilt.
Yes.
Yes.
Because you are
That's good.
thinking, I'm not a good parent, like
Yes.
you mentioned, and you feel guilty.
Yes.
And guilt and shame is another precursor of to mental illness.
Mhm.
Also, not getting enough sleep.
That's
That's
good.
key.
That's
That's
deep.
key.
When it comes to not getting enough sleep, I don't care if it's postpartum. I don't care if you're just a regular average
Mhm.
person. Sleep deprivation is a precursor to mental illness.
Wow.
Yes.
And you said it's a little loud, so
Yes.
grab that.
Sleep deprivation
And
is
tell them what that is.
not getting enough sleep. Your body is shutting down, your brain chemistry changes, and you cannot function. You cannot function. It causes suicidal ideations, depression, anxiety. It is a precursor to true
Wow.
mental illness, not just sadness,
Yes.
not just frustration, but true mental illness. So mothers don't get much sleep. Their hormones are low. And then
They
That's-
can't
yeah.
focus.
Can I-
yes,
You want to
jump
ask a
in, jump
question?
in.
You want go ahead and jump in, then I'll come back and ask that question.
I was just going to say what sleep deprivation also looks like is
Good.
scrolling through your phone in the middle of the night,
Mhm.
sitting on your tablet in the middle of the night,
Yes.
having the TV and movies on in the middle of the night. A lot of people also
Overstimulation.
overstimulation because you never bring your brain down. That's
That's
what
good.
happens. And so, just wanted to give that real world.
Yes.
What does it look like for you? It could be, I used to go to bed at 9 p.m. Now I'm up at midnight,
Yes.
1, 2 o'clock.
Yes.
Or I used to get up at 7 a.m. Now I'm up at 4 or 5
Yes.
and working out. So sleep deprivation means you've changed your typical sleep pattern, your sleep cycle, and have replaced it with something.
Wow.
And then now you've opened the door, yes, for suicidal ideations, but the biggest type of ideation that happens with postpartum depression is homicidal.
Come on.
And very
Especially in
often
men.
with the men, but very often both the men and the women, they want to harm, if not themselves. That's suicide. Homicide means you want to harm the baby.
Yes.
Wow.
I'm going to shut down for that.
Oh no, that was good. There is another question, and if I don't see your question, please throw it back again for me. That's why y'all see me. I don't have no problem getting up and coming in front of the screen. I will do that.
Yeah.
So I saw another question that was very powerful, and I want to make sure I'm pronouncing your name. It says Shell Walk. She said, "Can an adopted mom parents battle with a form of PPD?"
Absolutely.
Yes.
Yeah.
Yeah.
Okay. So absolutely with that. Go ahead, go for it.
Some may say, well, if you haven't given birth, then and it's hormonal, then why are you having problems? In close proximity, there's called pseudo symptoms.
Wow.
So it doesn't necessarily mean there's also external factors. Like we talked about the child not sleeping and keeping you up, or feeling inadequate, or just other financial problems. It could be all external factors, marital problems, not having enough support, worrying about how I'm going to make it. I don't know what I'm doing. I have nobody. So external factors also contribute. That's why it does not have to be coming from your womb for you to experience this.
Awesome. I like that. And you guys pretty much answered the question. Is PPD is not my fault. Is it their fault that they experience a PPD? Or any mental disorder, matter of fact? Can we address that?
No, it's not. No.
I'll say any mental disorder is, like she said, a symptom. It's not really who you are.
I love
it's
that.
the thing, the external
It's
things
not
that
your
are happening
identity.
to you.
Yeah.
Yes, there are physiological things that's going on in your mind, but there are, like she said, external things that are, contributing to that. Your environment can contribute to that. It's not just your body; it's the person you're talking to. It could be yourself, what you're telling yourself.
Yes.
So that's a big thing. Also, that also contributes to psychosis as well.
Awesome. I love it. Anyone else?
Well, I just wanted to point out too that the chemicals in your brain switch based on your environment, like Ashley said, who you interact with, how you speak to yourself. There's cortisol, there's dopamine, there's different chemicals that will, serotonin, that will decrease. And if you don't have enough of that, it's difficult for you to function. You're always tired, you're irritable, and you don't have control over that once it gets past a certain point. And then what we do in therapy is teach you how to cope, how to do things to get your levels back up. Sometimes we use medication to help you to take the edge off so you can do the work and learn the skill set so that you don't put your brain back in that position again. And it takes time, it takes practice, but it can be done.
Well, I have a question for you guys. And if a mother is dealing with PPD, right? But they're struggling with breastfeeding. So where did that come from? With them struggling with breastfeeding because they're having a challenge with bonding to that child. What would we say, or what would be the advice for them?
If they're struggling with bonding, typically go ahead and bottle feed.
Yes, I like that.
It's okay. Do not feel guilty. Medicine will say one thing, but you have to have this individualized plan and be okay with your current situation. So you may want to breastfeed, you may have to build back up to that, but right now mama has to take care of mama, and you can't take care of the baby if you don't take care of yourself first. That's it. And here's the thing with breastfeeding.
Have me speak your tongue.
That's true.
Say you have to stop breastfeeding because honestly, what if the baby's in danger in your arms like that, or something's bothering you? Let's keep it real. We're talking about postpartum depression. If you have to bottle feed, that milk is still there for at least a year. So if you get out of that depressive state, you can return to breastfeeding if you and the baby choose. If you might try to put the baby back on, the baby say, I don't want it no more. And that's okay. But don't beat yourself up. Take care of you first. Just like Dana, when you're on a flight, they say put your oxygen mask on first. You have to, because you're taking care of a new life that is fully dependent on you. So take care of yourself.
So powerful. Go for add to it.
when you're breastfeeding a child, or even when you're in close proximity, they can sense what's going through.
Yeah, that would be my next
Yes.
question.
Yeah.
Roll with it.
Yeah.
Roll with it.
Mhm.
And you actually pass the anxiety, the
All of it
strife, the
goes through
strain, everything. It's not just coming through your milk, but it's coming from being close to you. They understand your
That's
heartbeat,
good.
your tone
Wow.
of voice, if you're tense and and they pick all of this up, and then that transfers to them where they end up with anxiety. They end up crying all night, and it's worse
so
for
good.
you
That's so
because
good.
now it's like, okay, I have this baby that just won't stop crying, that's always discontented, but you don't realize that he's picking it up from you. So
Wow.
you have to
So
get
good.
yourself straight.
Yeah. I one thing that I do want to add to that, because a lot of mothers are now coming, and it's okay. They want to breastfeed, right? But what you can do is pump.
Yes, you can.
Yes,
And they still get the
Right.
milk.
Yes.
You can still pump because most of them are like, oh, I think it's more nutritious. I think it's more healthy for my child, which it is, right? But it's okay to pump and put, that milk in a bottle, right?
Mhm.
And
in
then
the
I know there's
freezer.
a life
That's it.
a life shelf that you can put that in. I was talking to one of our other therapists the other day, and she was sharing that you can even freeze it.
Yes,
right?
Yes, she just,
So that's another thing too, that you can actually still breastfeed,
Mhm.
right? But you can also pump. Now you guys tell me what you think about this, right? I favor the pumping, right? Because then that way, if the mother needs to go out and do self-care, like getting the nails done, I'll call and say, hey, let's go get some eat. I'm big for that, right?
Sometimes I gotta go
Or
back to
just want to
work.
get up with the girls. The baby is still getting what they need,
Yes.
Yes.
and you are also getting what you
What you
need.
need.
So what you guys think about that?
Yes.
100% agree.
Yes.
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 And if you go out, you're gonna have to pump because your body's on a cycle.
Yeah.
It knows when it's time to feed, so you're gonna have to pump.
Yeah.
You're gonna be all wet if you don't.
And so definitely got to pump. Go for it.
Go ahead.
I was going to say.
Oh, that's why you used to breastfeed, right?
Yes.
I did too.
Me too.
All four.
I was going to say as well.
And she did a good job.
The baby, your body reacts to the baby sucking. So like if
Yes.
your body's
That's
not,
good.
so going back to kind of what you said about the baby feels it, if the baby is not like latching on, if they feel the anxiety,
Wow.
your body is triggered when that baby is, sucking and doing all that. So if they have anxiety because they feel your anxiety, your body's not going to generate milk anyway.
Wow.
So it's important. So that's why I do agree with the pumping, because it's like your body's in a
Stimulates.
constant
Keep
flow.
it stimulated.
Yeah.
It knows like, okay, I'm doing this. I don't. It's like mechanical almost.
Yes.
Versus,
Oh, that's good.
That
with the
is
child.
good.
Remember, you release that oxytocin as well. So
Yeah.
not only do you get it, but that baby gets it
Yeah.
as well. So your
Wow.
body reacts to both. It's a reciprocal thing between you and the baby.
Yes.
Yeah.
Yes.
You have something you want to share?
Well, she mentioned oxytocin.
Mhm.
That is the chemical that bonds your child
Mhm.
and yourself. So if you're stimulating your breast by pumping
Mhm.
and you're getting that release of oxytocin, even though you're not holding your baby, you're still bonding.
Yes.
Wow.
Because that
Yeah.
chemical is being released in your
Yes.
brain, and the more it's released, the more you'll find success in bonding with your child.
So, audience, let us know that you got that, because they both said something very, very powerful, and that your body's going to still be bonding and you're still releasing that chemical in your body. So definitely want to hear from that. So y'all ready for us to go just a little bit deeper?
Let's roll.
I'm going to ask, and the first Dr. Delandro, and even if what's her name again? Even if Ashley, because I am aware, that Ashley was breastfeeding. So are you guys open enough to be honest? I think me and you had a conversation that you personally dealt with PPD. So talk to us a little bit about that.
Absolutely.
So we okay with being transparent, right? So talk to us about that, because somebody on there, even though we're therapists,
Mhm.
right?
Yeah, we're good.
And yes, we have the degrees behind our name,
Mhm.
but we have experienced some things as well. Definitely experienced some things as well. There's a question. Can you talk about doulas that? Oh, okay, I like that. Let me read that. Hold on a minute, guys. Let me pull up for y'all tell your testimony.
Mhm.
It says, "Can you talk about doulas that assist after having a baby?" That's good.
There's a doula on the line, Rochelle Walk, that she's also asking
Rochelle, let us
questions.
know. Put it out there. Say, I'm
licensed.
here. I'm here. So yes, talk about that.
Yes, so doulas are amazing because bottom line,
That's
you
good.
need
I like that
help.
question.
You need help. And so too often in our society is you got to be this independent person, and you also have to learn to be okay being vulnerable. And so again, the key again is asking for help. We need each other. I see Rochelle just responded. She said yes. She is a postpartum doula. And so there's a career out of this because it takes a village. It really does. With that one little baby, but also for the mama, for the daddy, for any siblings, for the grandparents. The doula is there to assist you with that sleep deprivation. They're there to assist you with breastfeeding. All these key components that are needed for motherhood and fatherhood. So yes, doulas are amazing. Just like if you want to have your house clean, a doula's not going to clean your house, but I'm just saying you can get somebody like a cleaning company.
A baby sis.
Yes. But they can help coordinate things with you. It depends on how far in services they go, but they're there to just help you as you ease into parenthood.
And she said something so key. I'm just going to touch it and run back out. It's okay to be vulnerable, all right? Because being vulnerable, it allows us to get the help that we need. I'm going to drop that and come back later. I think we're going to do a live on that. The importance of being vulnerable, right? Because we have been taught so long about not being vulnerable, but there is so much is good and danger with that, right? So it's okay to be vulnerable. It's okay to say I need help. It's okay to say I don't have it together.
That's
right
good.
now.
It's okay not to be okay.
Yes, it's okay not to be okay, right? I love that, and that's one of the models that we live off of. It's okay not to be okay, right? So let's dive really back into. I don't see any more questions. They said the doulas said we do like housekeeping too. Awesome. So Dr. DeLandro, take us into when you first, now you know it because of the education that we have, right? But take us back to when you was experiencing or having PPD.
Absolutely. So looking back at it, I had experienced depression throughout high school.
Right.
And so entered into marriage, got pregnant with our first child, and we're talking almost 18 years ago. And so healthy pregnancy, healthy delivery. The day that I got home from the hospital, I sat on the couch, the baby's there in my arms, and I just began to boo-hoo cry out of nowhere. So I thought. And so I just had these continuous crying episodes. And then this paramount amount of fear just rested on me. And and again, that's still very natural. Is what am I supposed to do with this new little person? And so, but I realized that a few days had passed, and I realized I wanted to hurt the baby.
That's good.
Although extremely in love with my child, I'm going to keep this 100% real.
Yes.
I remember I wanted to just take him and toss him into a ceiling fan. I remember I just wanted to throw him away.
Thoughts.
And the thoughts were so intrusive, but I'm looking at him like, but I'm in love with him. I couldn't understand what was wrong with me. The two didn't connect. I was happy to be a mother. I knew I was ready to be a mom, but I wanted him hurt for some reason. It was just weird. And so the very first thought of hurting him, I called my mother. I called my husband, and I had a great support system. So support system is also very key. That's why I said reach out for help. You may have to develop your support system, but everybody on this panel and from Virginia Therapy Services is ready to help you. You are not alone in any circumstance. And so I called my support system, and along with my sister Shakita, I got to shout her out. My mother, my sister, and husband then had to work around the clock to not keep me alone with the baby until I was psychiatrically stable again.
That's good.
So there's a difference in psychologically stable, psychiatrically stable, emotionally. But what happened was it kicked into, for me, postpartum psychosis. I began to experience the hallucinations. I began to experience the delusions, and they all lasted for almost 2 months. But again, that's why I'm so big on understanding postpartum psychosis. I thought I was okay, y'all. No, I was sad. I was sad before I got pregnant. I was sad during the pregnancy, happy to have the pregnancy, but still sad for other life reasons. Then again, external factors. Thank you. And then again, very sad and hormonal after I gave birth. Didn't know what I needed to do.
It's a combination, right?
Absolutely. It was a combination of everything, but my biggest key was support. I went to see a psychiatrist. Y'all, the psychiatrist laughed at me. He said, it is nothing wrong with you.
Oh.
I said, but I'm hearing voices. I'm not going to go into the prophetic piece, but I was hearing. Because when you give birth, you're wide open.
Yes.
But that's a whole different
That's a good
thing.
one, April.
That's a whole different
That's good,
thing.
April.
And so what's in you is going to come out when
Yes.
you give birth. And so, but again, even the
That's
psychiatrist laughed at me, but he commended me. He said, you're so young and you knew to come and get
Ask
help.
for help.
That's
Yes.
the key.
I didn't even get prescribed medication. He put me in weekly group therapy
Wow.
with other women that had postpartum depression.
Yeah.
And I was in there for a year. I got chills thinking about it. But I was in there with these women for a year. And they were struggling with depression before they got pregnant.
Yes.
They were struggling with schizophrenia during pregnancy. We all had different life walks, but it was still support. So the two key elements that I mentioned were reaching out for help, but I had support at home. The psychiatrist himself sent me to a support group.
That's good.
And then after I left the support group, I ended up in support with individual therapy for another
Yes.
year. So I learned in all of this, did y'all know that postpartum symptoms can rest in your mind
Come on.
for 7 years
That's why I was waiting.
after you give
That's what I was
birth?
waiting on.
So imagine you have a baby and then another baby and then another baby. You have restarted your
You
psychological
restart the
clock
clock.
and
Yes.
your hormonal
Yes.
clock. And so that is what happened to me. And I had 4 children and all of that good stuff. And no, I didn't experience postpartum after each child. I did experience it with 2 children. But because of the first one, that pillar one, I knew what to do when I saw it again early on.
Right.
I ran to the psychiatrist. He said, if you don't stop coming to the psychiatrist, you just need therapy, April. I was like, give me some pills, but you don't, your circumstance will be
Depends on
yours.
you.
Yes.
If you need medication, take it. Discuss it with your doctor if it's safe to take the medications and still breastfeed. Follow whatever the medical or psychiatric plan may be. But again, it's no shame in it. What you think of me is none of my business. And I'm here to testify and help the next generation or the next woman understand.
Wow.
Can I ask April a
Yes,
question?
go for it.
Yes,
Ask
ma'am.
her.
April,
Yeah.
what is the difference between the baby blues?
Mm-hmm.
Because that's a thing.
Yes,
Yeah.
it is.
Yes, it is.
How do you tell the difference between that,
Yeah.
which is natural, and postpartum depression?
Absolutely. The time frame. That's it. That's just it. It's just the time frame.
Yeah.
So baby blues, I think is literally 9 out of every 10 women experience baby blues.
Right.
So about 90%.
Mhm.
Versus
Yeah.
postpartum depression, once you hit the 2-week mark and then the 6-week mark, that 6-week mark is key.
Yes.
It's very key. So it's really just the timeline of it. The symptoms are the same.
Yes.
So you're still battling kind of moments of sadness, feeling overwhelmed, irritated, for men angry. But again, the timeline is the same, maternally or paternally. But baby blues, you'll hear that a lot. Especially, you can actually, one more key element.
Take your time.
Baby blues starts like after the feet came out of you.
Yes.
Yeah.
Immediately.
Mhm.
Versus postpartum depression doesn't set in until about 2 weeks after the baby's been
That's right.
born. Those are the 2 key elements.
Okay, awesome. Somebody said, thank you for being vulnerable. Thank you for being vulnerable. And it's very helpful. I have a question, and I think I'm also going to address this to Dr. DeLandro, right? We may have somebody listening today, or we may have somebody come back and listen.
Yes.
I know that I'm dealing with PPD or postpartum depression, but I'm afraid they may take my baby.
That's a good one.
That is a very good one. So
Oh, wow.
let me back up because I heard about this as well in one of the groups.
Mhm.
They cannot take your child unless there is a consistent concern for the overall safety of yourself and the baby.
That's right.
And so, yes, you can express, oh my goodness, I'm scared. I thought about hurting my baby. The only reason they didn't take my son from me is because I had a support system.
That's the key.
I had a support system.
Mhm.
Had I not, I probably would have willfully gave him
Yes.
because I was so afraid and I wanted him to live. That's how
Okay.
deep it was. I wanted him to be safe.
Yes.
But they can, yes, they can take your child from you, but they're not going to do it to the extent. And when we say that they can, we're talking about Department of Social Services. And typically Department of Social Services, let's think of social goals, is to reunify families. They want the family to stay together. They want the baby to stay with the mother. But if you can show I am actively working on this
system.
and I have my support system, there's nothing to
That's
worry
all I
about.
want. Yeah, that's all I want. Yeah, so you want to ask?
I was just gonna say mine was the complete opposite of yours. Is you gonna?
That's good.
That's fine. Go for it.
Talk about it.
I didn't ask for help. I
And
didn't
did
know.
not speak a little louder.
Put the mic on. That's good
But
though.
this is good though.
Yeah.
I shut down.
That's
I didn't realize it at first, and even for me, because I was already afraid because
That's right.
I was already going through a transition in my life already. But I just had a miscarriage a couple months prior to, so I was already fearful of like, oh my God, I don't want to lose my baby, and I had complications, so it was always that, oh man, like what's going to happen. So then I already was battling with depression before,
And
so
anxiety.
then yes, anxiety really bad. So, I went through these things. So when she came, it was just like, okay, I threw myself into it. It's just like, okay. And I also felt like postpartum is another thing too. I felt like nobody else was safe with my baby but me.
That's
good.
another symptom.
Yeah. So it was even with her own father. Like
That's
it was
good.
like I didn't
good.
trust him. I didn't trust anybody. It was, this is my baby. This is what I'm supposed to do. I'm supposed to
Obsessive
breastfeed her.
behavior.
Attachment.
Yes, trying
Say it
to-
one more time. Excessive behavior.
Excessive attachment.
Excessive
Yeah.
attachment.
Go for it.
Yes, and it was like I wanted to, keep her safe at the end of the day. And then, I breastfed her. So it was like, and then what I ended up doing, and not unbeknownst to me, is that I got her tied to my breast, so she didn't want to go to anybody.
That's right.
So then it became a point that I want to go to work. I want to do these
And
different
you
things.
couldn't.
I couldn't. Because I was
That's
so,
good.
I had, boxed myself in a sense.
Yeah.
And
That's
then
good, Ashley.
when she stopped breastfeeding, then it was like, oh, well, she doesn't need me anymore.
Yes.
So then it completely switched
That's so
to now I'm
good.
like, I'm not good enough for her.
That's good.
Those
I
thoughts are
can't-
something.
I can't, I can't function.
Cognitive
What am-
distortions.
Yes.
There
what
we
am I
go.
here for?
I'm
And
sorry.
even
And that was it.
We saw it. Y'all, these are church. These are church therapists. So if y'all hear involved in speaking in tongues and all of that,
April,
and how they boosted each
That's
other
good,
up,
though.
that's
That's
just
good.
the church coming out, Anna. But go ahead, Ashley.
and the crazy part is I had a great support system.
Yes, you
But
did.
and I was in a house
You
full
wouldn't
of
use it.
people
Yes.
that were there for me, but
Yes, they were.
I felt so alone and couldn't even see them.
Yeah.
They were doing things. They were there, but like in my mind, I was so distorted in my mind that I could not see them. And what that looked like is
Wow.
me, sitting in the room, blinds closed, doors closed, not wanting to come out, not cleaning up, couldn't even get myself together, didn't even know if I wanted to take a bath or not.
That's
that
good.
day.
That's
And
good.
It took a lot just for me to get up.
That's
I knew
good.
I had to take care of my child, but it was like, okay, that's pretty much what got me out of bed. But that was the only thing. Crying yourself to sleep every night.
Mhm.
It's, like I said, postpartum can look like, again, not cleaning yourself up. And that's real. You don't have to feel guilty about that. That's
I
real.
love it.
So it even got down to the point that I felt like, okay, she doesn't need me anymore. So unbeknownst to my family, I had kind of vetted them, like, well, who she's going to go to if I'm not here.
That's right.
I had got to the point of suicidal ideation.
Mm.
I didn't want to hurt her, but I don't even know if my sister's on here, but I had a conversation with her. She didn't even realize what I was doing at that point. But it was like, okay, if something happened to me, would you take care of my child as if I would?
Start making
She didn't even know
plans.
that. I had made a whole plan to do it.
Mhm.
But this is real.
But
This is real.
and it's funny because I had set a plan and everything to do it, but the next day, my sisters called me, the village that I have. They called me and was like, okay, we're just gonna come and get you. And I didn't do anything special. All they did was come pick me and the baby up and just roll me around. And that meant a lot to me. And like I said, although of course they talked some sense into me, but it took them coming in like, okay, you're this, you're okay, I've been through this. And it took me getting laid out saying, okay, what's wrong with the
laid
baby?
out part.
But no, that helped though to let me to bring life back into the situation, to let me know that you're the only one dealing with this. And so again, like what I was doing, and even with like my child's father, by me keeping her from him, of course you gotta realize, you're hurting that child as well. So me thinking I'm trying to keep her safe, I'm harming her.
Yes, that's good.
I'm
Ashley.
damaging her at the time. So it's like, okay, you gotta do that. And then it's like, okay, well, you trying to take my baby from me? No, it's not that. It's so you can go out and go do what you gotta do and get yourself together.
Yeah.
And just, it wasn't even just about, me taking care of the baby. It was about me just wanting to do things for myself.
That's
you know,
good.
just taking care of myself physically.
Yeah.
So, and as a postpartum person, you have to take care of yourself.
Yes.
You just had a baby, and then too, like this was months. I had reached a part of psychosis because it was the lies I was telling myself in
It's the
my head.
thoughts.
Yes, that's
It was-
good.
yeah.
That's good.
You know, in my head, it was just I was like this. Nobody could tell me anything because I was just so
That's
it was
good.
so bad. I was talking to
Fixated.
myself.
Yeah, that's it.
Yes.
That's good.
And-
I have a question for you.
Yes,
Did you experience paranoid thoughts?
absolutely.
Yes.
Yeah. What did that look like?
It looked like oh, he's gonna try to take my kid from me.
Yeah.
Oh,
Yeah.
it looked like they don't like me. Oh, it looked like they think I'm gonna cry. They think it's a cry for attention if I try to speak up. It was a lot of things.
Mm-hmm.
Oh my goodness, yes.
Yeah, because that's one of the key things to
Yeah.
look for.
Yeah.
Even in family members, if you hear a certain verbiage, if you're connected to them enough for them to be asking questions about if I'm not here, would you? If they start giving things away, then you can kind
That's right.
of pinpoint where their head is.
But see, I knew that.
Because you're a therapist,
That's
So-
that's good.
so
like
you
that. I
worked
knew that.
around that.
So I worked around it.
Yeah.
It hides
Yes.
well.
Mhm.
I do want to indicate that. I'm sorry to cut you off. I was just going to say it can hide very well. And so that reminded me how Ashley was checking out. I started to think and Google searched, how long is a jail stay? What are the sentences?
This is
I
good.
started to look it up and I was like, because I was just
Mhm.
That's
afraid.
good.
Yes.
That's
And
good.
I'm like, so how much does an attorney cost to cover me?
Mhm.
And then once I realized I got to that point, suicidal ideation started to come to me. towards me. So I started with
To
homicidal.
try to protect
Yeah.
the baby, I'll take
Yeah,
myself.
that was
the
it.
thoughts are
I
very
shifted it.
distorted.
But
yes.
I became comfortable in the suicidal ideation because I didn't want to hurt the baby.
Mhm.
I then said, okay, I'm safe.
Wow.
Because then if I hurt me, I'll be okay. You know, the baby will still be here.
Rationalization.
Yes.
Well-
Yes.
Go ahead, Sonia.
Well, I was gonna add to that because people don't. I was gonna add that people don't realize. She said a little louder. That also too, events can trigger you to have postpartum because with me,
That's good.
I had a major loss that kicked me into postpartum
Mhm.
depression. Whereas when my baby was like 8 days old and not knowing what to do with him. So when I lost my mother, it kicked me into postpartum
Yes. Yes.
where I wanted to just, I just sit there and
It's
look at the
external
baby
factors.
crying and didn't know what to do with him. So I began crying.
Mhm.
So I cried all the time and didn't know what to do with him. And there were times that I was like, I just wanted to give him away.
Mhm.
Those were thoughts that like, you know what, you don't need this baby. You're not going to be a good mother. You don't know what to do with him, and then there were times, like you said before, where I literally thought about, okay, well, hey, I can't live anymore because, my baby be better off without him.
Yep.
So I was planning to give my baby to my sister. So I knew that she would take good care of him. But they,
Some common thread.
but like you said before, when you have a great support system, because of that loss, I didn't know how to take care of my child. And then I felt like I couldn't live without my mother because that was who was taking care of my baby.
Wow.
So when that triggered, and to keep me stable, that's where my family did around the clock.
Yeah.
Because I didn't want the baby. And the baby would literally be crying and I wouldn't even hear him. I would sit right beside him and didn't even hear him crying because my mind had checked out.
Yes. That's
So
it.
really I was like, okay, let me, I had really shifted. So if it had not been for the support of my family doing the round the clock and helping me, but back then I didn't understand what it was. But there are events that can trigger postpartum.
Those external
that can
factors.
kick you
Wow.
into postpartum. And, it's not just with, like you said, with one child, but it was with both kids because, then later on, you have another child that you're sitting there like, okay, what do I do with this one?
Yeah.
Wow.
So, yes.
This is really, really good. I am going to just kind of give some symptoms, and we are still just watching your comments. But before we go today, we're going to do it, virtual, where we're going to ask them questions, and if they're in that, and then we teach them how to add them up so they can see if they're actually sitting in postpartum. So I definitely want to leave with a great intervention tool with that. So we're definitely going to do that for you guys. But some of the feelings that they go through, and they have mentioned here, again, we are still watching to see if you have some questions. So one of the things that they all talked about was feeling depressed most of the day, every day, right? So they talked about that very a lot. Feeling shame, I've heard that. Yes. Feeling guilty or like I'm a failure, right? And I love it how each and every one of them were very transparent.
Yes.
Right? Because if you look at these ladies, they are extremely beautiful. They are extremely educated. And they put up with me. But the fact is, they're letting you know that they've been through or went through some stuff. So whether you're still experiencing it or not, but look where they're at today.
Yes.
Look where they're at today, right?
Listen.
Go ahead, go for it. Go ahead.
May I?
You may certainly can.
But God, somebody commented it on there.
But God.
But God, that's it. I just want to say, and if I may,
you absolutely can.
You may not have family supporting you. I can't stress this enough. Yes, the three of us have shared, we had our family to support us. And I know it can be lonely for someone that is a single mother, that may be a single father. Yes. I just want to reiterate, call the number on the screen, reach out for help. Yes. If you are down like to your wits end, it's okay to pick up the phone and call 911 and say, I am scared. I don't know what I'm going to do. And so not only that, there's also local resources for postpartum depression, for mothers, for fathers at the library. You don't want to stay in the house. You might be afraid of being, in the house alone with the child or whatever. You can go to the library. There's so many groups and activities that they offer, especially for new parents. You can also reach out for help back at the hospital where you gave birth and ask them, thank you, for resources. So I don't want you to ever think that you are alone. Again, you may be a single parent. You may be in a house by yourself. You may be disconnected from family and friends. That is okay to not be okay, but just know that there are resources. And again, if you just hit this point of no return, understand, just pick up the phone and call 911.
I like that. Definitely like that. Anyone has had something you want to add to that? Yes.
I wanted you to go through the symptoms, like you were, and then I wanted us to talk about the protective factors and the risk factors.
I love that.
So you kind of get a feel for who it has a propensity more likely to get it. And there also is prevalence among the African American and Hispanic communities. So I wanted to just touch on that.
We can definitely do that. So we talked about feeling shame, guilty, or like failure, right? Let's look. Another symptom is feeling panic or scared a lot of times. Feeling panic or scared a lot of times. So what I'm doing, I'm listing some of the feelings or the emotions that you may be experiencing. If not you, maybe someone that you know, a loved one, may be experiencing it as well. Having severe mood swings. Having severe mood swings. Let me list a couple more. Then we're going to turn back to these great therapists. Feeling tired all the time. Right? We don't want you to ignore any of these symptoms, right? And I hear this in my ear. I need you to understand that you are never a burden to no one. That is a lie. That's another symptom of another voice saying to you, I don't want to get on somebody's nerves. I know they're tired of me. No, ma'am. No, sir. Another one is eating a lot more or less than normal for you. Another one, which is a big one, is gaining or losing weight, right? And so again, even though we're talking about this, if it's not you, it may be someone that you know. So we definitely think it's important that you learn these symptoms as well. Hear me. If there is a pastor preacher, teacher, fivefold ministry. This is so important because it is sitting in our church.
Oh yeah.
It is sitting in our church, and I don't want us to overlook this anymore. It may be that I just had a baby, and let's say 8 weeks went, and I don't show up to church. It's time to go find out why you're not showing up to church. They may say, "Oh, because the doctor told me to stay over 6 weeks." Whatever it is, still check in. Right? Still check in. If you can't check in yourself, have somebody else to check in, right? And if they're not doing the activities like they used to do the activities, someone please definitely check in. Another one, and I heard you guys say this a lot, having trouble sleeping or sleeping too much.
Yes.
Right?
Having
trouble
sleeping too much is huge.
Or sleeping too much is very huge. Are you hearing me? And another one, and like I said, this is not all of it, but we're just listing some. Having trouble concentrating or making decisions. You heard us talk about this. Having trouble bonding with your baby. But I hear this one. Also having trouble bonding with your significant other.
That's it. Yeah.
Right? Where you feel like you can't bond in that piece anymore. Here's the one. I know April talked about it a lot. Thinking, and so did Miss Ashley, thinking about hurting yourself or the baby. Thinking about hurting yourself or the baby. Please reach out to a therapist, a trusted friend, your pastor, anybody that you know that you can trust, right? So that we can help you with those thoughts. And then thinking about, I think I heard you say this, suicide or killing yourself. We need you to know that this is so serious.
It is.
It's very serious. And we are actually taking it extremely serious, right? So Dana, I'm going to turn it back over to you because I know there's some other stuff that you wanted to add with that.
Okay, so I was just going to kind of do a collaborative thing. So there are risk factors. People who have the propensity or more likely to get postpartum depression. And then there are protective factors, things that you can put in place throughout your life to make sure that you are less likely to get it.
Yes.
And so I just wanted to get some feedback, especially those of you who have experienced this on that piece. So maybe start with the risk factors.
Yeah.
So we already talked about depression puts you more at risk, right?
Yeah.
Depression puts you more at risk. Financial problems put you more at risk. Like if you've had previous depressions or financial problems, if you have like marital problems, relational issues. If you don't have support systems, these things put you more at risk of having it. So when you deal with the protective factors, that's the opposite, right?
Right.
So basically, what do? You get support systems. You want to get help if you have financial challenges. Deal with the counseling. If you have marital problems or relational problems, things like that will be protective factors so that you don't get, like Anyette said, kicked into it, triggered into it. So I just wanted to kind of bring that into play.
I like that.
The other piece I wanted to talk about is African American women. There has been an increase in postpartum depression at 150% since 2011.
Yes. Please say those numbers one more time.
150% increase for African American women. And African American women are 40% more likely than Caucasian women to suffer from this. And Hispanic women also. I don't remember the stats.
It's not far behind.
So African American people of color, let's put it that way, have the bigger risk of getting postpartum depression as opposed to people of other ethnicities.
And I'd like to say that's a lot to do with, we have a problem sometimes with being vulnerable, is asking for help.
That superwoman syndrome.
I'm not.
We're supposed to be able to handle it all.
But if I need somebody to put up there, it's okay to ask for help. Definitely, it's okay to ask for help. Anyone else before we go into our questions?
I was actually going to say this on the screen. Don't suffer in silence. You don't want to hide from what you're going through.
Mhm.
And so Dana mentioned those are some pretty
Yes.
alarming statistics to
Mhm.
see that there is an increase. And you don't have to pretend to be strong.
Yes.
You can be strong in other facets of life, but in this moment, if you need help, just simply ask for the help. And I think it's also key that, especially for those that are in church or call themselves church leaders, to equip themselves with those protective factors. How do you answer someone that comes to you for help in this matter?
That's good.
So it's okay as a leader to say, I'm not exactly sure, but let me find the resource for you.
Right.
So at minimum, again, if you're a church or any other type of facility and you have where people are going to come to you for help and it's not really in your scope, that is okay, but find the local community resources available. There's so many resources available, but yet we still suffer in silence with this. We still don't want to ask for help. We don't want to be vulnerable. We want to seem strong. We want to be with
Save
these
face.
LLCs and have all these
Save
degrees.
face,
We
I
want to
like
sit
that.
here and be these CEOs and all. You can be all of that, but right now you need to be that baby's mother. Okay?
Yes.
And so you can have all these accomplishments, but we want you and the baby to stay alive.
Yeah.
And so it's just key in understanding what's really, how do you prioritize this? So again, we say ask for help, but where do you ask for help? You may not even be in Virginia on the screen.
That's good.
And again, you can reach out to us and we'll try to help locate
We'll
some
refer.
resources, right? But and again, you can go to your local church, and I don't want to keep going in circles, but it's just key how asking for help saved me and my baby's life.
Don't just try to suck it up.
Yeah.
And ask for help.
Ask for
If you're
help.
feeling some type of way, even if you
Yes.
feel a little bit, go ahead and ask for help. You are more important.
Mhm.
You are more important than that job. You are more important than those
Yes.
symptoms.
Mhm.
You have hope. Let everyone help you.
Mhm.
And there are people that do want to help you.
That's
Yeah.
That's true.
That's
You know,
And they're-
that
and
was
they're
one thing
equipped
that
to.
I dealt
That's
with, that I thought that, again, that burden, thinking that you were a burden. No, there are people that
That's
do
good,
want
actually.
to help.
Yeah.
So just know that there are those people out there that, you specialize in this type of
Mhm.
stuff.
Yes.
Hey, so here you are. All
Yeah.
that number, do not suffer in silence, and you are way more important.
Yes.
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 I like that.
Yes.
You are way more important. You are priceless.
Yes.
I love that. I think Dane's going to say something. Then we come close it out with you.
I wanted to just say to the leaders, do not be dismissive.
Ooh.
Yes.
Sometimes we are encouraged to pray, to be strong, to push
You
through,
touching my lane
to
now.
push through this. And we can't if it is a bona fide
Yes.
illness. It is not possible
it.
to just snap out of it,
Nope.
to push through it, to pray through it. Yes, you pray, but there's also actions
Pray
that come
and act.
behind prayer,
I love it.
And so you have to pull together the resources, do the work, get the help, reach out. And just as leaders, don't be dismissive. As parents, mothers, fathers,
I love
don't
it.
be dismissive. Oh, everybody's had a baby. Oh, you get over it. It's real
Yes, ma'am.
and it's dangerous.
Yes,
Yes.
it is.
Yes, ma'am.
Yes.
Yes,
I'm
ma'am.
sorry, say that one more time. It's dangerous.
It's dangerous.
Yes.
I love it. I love it. I love it. I love it.
Yes.
Miss Anya?
Yes. Just a reminder that you and your baby are both valuable.
Mhm.
You are
Wow.
both valuable. So many people think that, well, I'm not worth it, but you are worth it,
worth
and
it.
so are your baby.
Wow.
You both
Just
are
good, Anya.
valuable. Yes, and you have to remember that. And it's
Mhm.
okay to not be okay.
It's
Mhm.
okay.
And you have to be open about it. Don't sit and just keep stirring in it. But when
Because it
we're
gets
giving
worse.
you
Mhm.
awareness tools and techniques, because we want to let you know that this is how you are aware of what you're going
Yeah.
through.
Mhm.
A lot of people don't realize what they're going through.
Mhm.
But now with us sharing this,
Mhm.
people are aware of, oh, wait a minute, I'm in postpartum or I'm dealing with that. So when you realize that that is what you're dealing with, or any type of disorder or depression or
Yes.
anything
Mhm.
that you're battling with, please, it's okay to be open
Mhm.
and reach out to get the
That's
help that you need for you and your family.
Mhm.
So I love this. As I was going back over and looking at the questions, you guys hit every question there was.
Wow.
Right? And so to close out, I am going to come back again. Like one of the questions was, I have not been able to laugh and see things funny, right?
Mhm.
Another question is, I have looked forward, I have having challenges looking forward into enjoying things, right?
Mhm.
Another one is, I have been blaming myself. Another one is, I've been dealing with anxiety.
Mhm.
Another one is, I've been feeling scared and panicky, right?
Mhm.
So pretty much you guys have hit a lot of the symptoms, right? So I'm not going to read the questions like I said I was, but I am going to have each one of them. We're going to go back again because we're getting ready to close out. Again, thank you, everyone. Please share this. You can come back and take the notes later. You can reach out to us. And like Dr. Delandra was saying, if we're not in your state, that's okay. We know how to reach out to someone in your state, or you can do psychology today for your area.
Yes.
Mhm.
Yes.
It's a great tool.
Yep. Do psychology today for your zip code. Matter of fact, you'll find all of us on psychology today as well. But whatever area you live in, whether it's New Jersey, whether it's New York, whether it's Georgia, whether it's California, wherever you live, definitely put your zip code in there. And as you look for a therapist, make sure you find one that fits who you are.
That's
Very
important.
important.
Good fit.
A good fit. You have to have a therapist that's a good fit. You have to feel good about your therapist. That is so key. You have to feel good about your therapist. You have to make sure that your therapist is listening to you and following what it is that you need.
It's a partnership.
Yes.
Yes.
Yes. It is a partnership.
Yeah.
A lot of people I'm finding that want continued therapy because they're not really comfortable with their therapist, or either they haven't bought in or the therapist haven't bought in to them. And it's okay to keep looking for one until you find that right one. Is that okay?
Yes.
Because I just heard some of you say, "Oh, I had a counselor, but it didn't work." It's okay. I did say something funny, but I leave that alone. Right? It's a relationship, like Dana said. It's a relationship, right? And so, ladies, before we hang up again, I do want you guys again. Let's give them each another intervention, even if you go back to the one you had, that they can use to help them with postpartum. And the first thing I'm going to start with, it's okay to reach out to your doctor, right? Reach out to your PPD, right? Your personal doctor. I got to remember I'm on screen. Reach out to your personal doctor. Am I saying that right, y'all?
Yes.
Right. Oh, your PCP. What your PPD?
Postpartum depression.
Reach out to your PCP, right? They can help you in reference to that. Just get started somewhere. So definitely want you to do that. Another thing too is find that support system. Find that sister, that brother that you can say, "Hey, I need to talk." Right? Go for it.
Yes. Well, basically, she took what I was
Oh, I'm
going to say.
sorry.
That's okay. But yes, you got to make sure that you have that support system in place, and also take the time for yourself. Do something for you at least once a week. Do something that you want to do self-care. Be able to make sure that you have someone that is willing to take care of your child while you go and do something for yourself. There were times where I actually would take a day and just go sit at the water and eat ice cream or whatever I needed to do. But I would take that time away and just, leave my baby with someone that I trusted. But that was a way to do self-care, whether you go get your nails done, your hair done, or whatever it is. But take at least once or twice a week, whatever you need to do, but take that self-care time just for you to step away to refuel and then go.
All right, Miss Ashley.
Let that grandmama or whoever it is watch that baby and go get some sleep.
And we will.
Get some rest, huh?
I like that's good advice. Let grandma, let auntie now, let them take care of the baby. If that's a safe place.
Yes.
Go for it.
Get up.
Yes.
Just get up, bathe, brush your teeth. I'm so serious. Get up, bathe, brush your teeth, and go to the library. Or also schedule something in the future for you and the baby so that you have something to look forward to.
I like that. That's good.
I like that.
Mine is do not feel guilty. You are not to blame. This is a natural phenomenon, physical and external contributors. So do not feel guilty. Go ahead and speak up. Check in with folks that you love or that you can trust. It's not your fault.
Yes.
Excellent.
So again, thank you guys for joining here with us. If there's a topic that you want us therapists to have with you called Talk Therapy, please let us know. And we will be back next month talking about the next diagnosis or the next mental disorder that we have out there. All right? Narcissism. You want to come back and do narcissism?
Let's do it.
All right. They want
Let's
to
do
come
it.
back and do narcissism. So we're coming back next month and we're going to do that. So listen, take care of yourself.
Yes.
And know that you're not a burden.
Nope.
Thank you for sharing with us your precious time. This is your pretty girl apostle. We'll talk to you real soon.